South Central Los Angeles Regional Center is committed to the health and well-being of all of our consumers. An important but often overlooked part of that commitment is dental care for children. That's why we've created the Oral Health Promotion Project. As a professional who works with children with developmental delays or developmental disabilities, you play an important part in this effort. And this training video is designed to help you help us promote good oral health for our youngest children. I encourage you to complete this training as soon as possible.
Teeth. We take them for granted, especially in light of the multiple problems confronting our children. Yet a nice smile is more than cosmetic. It's a sign of overall good health. Caries, or tooth decay, is the most prevalent childhood disease, more so than asthma. Untreated and uncontrolled, caries can cause pain and infection, which in turn can lead to problems with nutrition, speech, school readiness, and self-esteem. Children with special needs require more attention and are often at greater risk for caries due to sugar-coated and multiple medications, reduced saliva flow, motor abnormalities, and behaviors that might interfere with brushing. The Oral Health Promotion Project was developed to face this challenge. Our goal: to ensure that every child has a healthy mouth, and a key part of helping us reach this goal is you, the professional. The Oral Health Promotion Project is funded by the California Department of Developmental Services in collaboration with South Central Los Angeles Regional Center and designed to increase oral health services for children with developmental delays or disabilities.
Oral health is very important, and they're finding that the tooth decay that we see in children affects the entire system, and we want to keep these children as healthy as possible.
Social service and healthcare professionals are the first point of contact for families and caregivers, and that makes them a real important resource in identifying children who may be at risk of oral health problems. So we really want to make sure through this project that oral health is on their evaluation radar. And this is particularly important for children with developmental delays or disabilities because actually they have increased risk for oral health problems. For example, children with Down syndrome will have teeth erupting later, and also their teeth will be of different shapes and sizes than are usually normal or you see in other children. Also, children with developmental delays or disabilities may have motor abnormalities, which may cause them to fall easier, and this can cause trauma to the head and to the mouth. And we're not asking these professionals to be oral health professionals or dental professionals. All we're doing is asking them to increase their knowledge and awareness of oral health, so when they're out there with families and being the first point of contact and working with families ongoing, that they'll be able to identify risks and be able to connect these families and parents and caregivers to oral health resources.
Caries is an infectious disease, most often transmitted from mother to baby, especially if she has poor oral health. Yet it can be prevented.
We have two tools with caries. We can either prevent it, which is the most intelligent way of handling it, or we have ways of treating it where it doesn't become a crippling type of disease.
The Oral Health Promotion Project is a collaborative effort to increase awareness of childhood caries through screening and education. The project consists of 3 services: parent education, dental screening, and staff training. An oral health educator holds regular training sessions in which she explains to parents the importance of oral health for their children and what they can do to ensure that their children will have healthy teeth.
What I like it is that they will help me with my questions, because sometimes you don't know if you're doing the right thing. So it's good to find a person that knows more than what you do. So when I went to the classes, I asked Virginia if I was doing a right job brushing his teeth, and then she helped me, she gave me advices, and she showed me how to do it better.
A dental screening for children is part of each training session. A major difference between this project and others is that it doesn't simply screen children. It takes preventative action by applying a fluoride varnish.
We want them to understand where they can get the resources and the help that they need. And also, we want to do something to help prevent this problem. And what we're doing now, we're applying fluoride varnishes on children, as many as we can find.
Social service and healthcare professionals working with children with special needs are an important first line of communication, education, and referral. One of the most important things you can do is to fill out the Identification of Dental Risk Survey when you first meet with the family. It takes just a few moments, but it makes an enormous difference in educating families and caregivers.
What we do is gather information about the child and the parent. There's 3 questions that I look at, and they're way down at the bottom of this form. And this form, it tells me if the child is still on a baby bottle, the child is eating a lot of sugary desserts, and if the child is not brushing. And then the first 2 or 3 questions at the top of the survey tells me a little bit about the parent. If the mother has tooth decay, or if the caregiver hasn't been to a dentist, or he or she is having problems, and then this can lead to the child having tooth decay. It has been proven that by kissing a child in the mouth, that tooth decay or the saliva passed to the child through this kissing, or tasting the child's food, blowing on it to feed the child, we transmit bacteria.
The bug is there, you see. And so what we want to do is more or less control that bug. We can't eliminate it, but we can at least control it. And the place that you start is in the beginning. You don't wait until the infection is there.
In addition to filling out the Identification of Dental Risk Survey, there are several other things you can do, and they don't take much time. Tell parents it's important to take their children to the dentist by their first birthday, and if necessary, refer the family to a dentist. Provide information for parents on issues such as frequency of snacking, self-assessment at home, and use of fluoride toothpaste for daily brushing. Encourage pregnant women to be seen by a dentist as well as their physician prenatally.
You know what, you as a service coordinator maybe can recommend to the parent or the caregiver that they should have annual checkups or every 6 months, depending on their needs. The other is to make sure that they clean the child's mouth. Even if they don't have teeth, they have to get in there, clean the gums, clean the tongue, the roof of the mouth, and try to keep the child off that baby bottle as much as possible. Introduce them to the cups as soon as possible. We say that by the time they're 9 months old, they should be off that baby bottle or sooner. What you want to do is tell the parent or the caregiver that all they have to do is maybe like once a month is to sit the child down, put their head back on their lap, and lift their lip and look high up along the gum line for any of these spots. Brown spots is the beginning of tooth decay. White, chalky spots is decalcification of enamel, and decalcification of enamel will lead to tooth decay. What you can do is just tell the mom to be aware of any brown spots, any white spots on the teeth, so that they can get that corrected as soon as possible. And if you can correct it as soon as possible, it just alleviates a lot of pain and suffering for that child and for the parent.
Here are some tips you can offer parents. Don't put your child to bed with a bottle containing milk or juice. Don't let your child use bottles or sippy cups with milk or juice as a pacifier. Don't give the baby sugary drinks or snacks. Don't use fluoride toothpaste if the child can't spit. Do drink tap water. Do limit sugar. Do feed your child healthy foods. Do brush 3 times a day. Do have regular dental checkups. Do replace toothbrushes every 3 months.
A lot of the parents believe that because these are baby teeth and they're going to fall out, that they don't need to be cared for. That's one of the biggest, and that comes from all the different cultures, not just the Latino culture, but it comes from all, baby teeth are going to fall out anyway, so why spend money on them?
The 20 teeth of the primary dentition, also referred to as baby teeth or milk teeth, serve several very important functions. They aid in speech and help the child to form words. They help the child's self-esteem. They aid in chewing and digestion. Digestion begins in the mouth. And they provide a guide for the permanent teeth until all primary teeth have been shed, normally until the age of 10 to 12 years. Early childhood caries is an infectious, communicable disease that can be prevented through education and proper oral hygiene. A healthy mouth is crucial to proper development and the child's overall health and well-being. Look for brown or white spots. Brown spots are the beginning of tooth decay. White chalky spots indicate decalcification of enamel, and that will lead to tooth decay. The American Academy of Pediatric Dentistry Best Practices Standards says the child should have their first oral evaluation by their first birthday.
Make sure that they clean the child's mouth. Even if they don't have teeth, they have to get in there, clean the gums, clean the tongue, the roof of the mouth.
Avoid unhealthy snacks, such as sugar-containing beverages, apple juice, sodas, chips, and candy. Follow a daily routine of healthy nutrition and brushing. Never put a child to bed without brushing their teeth, and never put a child to bed with a baby bottle containing milk or juice. When in doubt, consult with your pediatrician.
Oral health is important, and the reason that it's important is that these primary teeth are the guide to their permanent teeth. Some of our children already have medical problems, some of our children with special needs, some of them are maybe delayed, some of them are already present, and we don't want to compound this by having tooth decay. Primary teeth with tooth decay affects their permanent teeth. So if we can take care of these teeth now, they're not going to compound.
Water with fluoride helps prevent tooth decay. Many people drink only bottled water under the mistaken impression that it is better. That's a major misconception you can help change, and tell families to check if their local water source is fluoridated.
Our water here in Southern California has fluoride, and trying to get the message to the parents that it's okay to drink the tap water because fluoride helps strengthen the teeth.
With just a few simple steps and a little extra time, you can get families and their children on the road to dental health.